Hello, and welcome. Today we're diving deep into the world of premature ventricular contractions, or PVCs. We'll explore what they are, what causes them, how they're diagnosed, and what can be done to manage them. Join us as we unravel this common heart condition. So, what exactly causes a PVC? Well, the heart's electrical system is usually very orderly, but sometimes a rogue electrical signal originates in one of the ventricles, the lower chambers of the heart. This can be triggered by a number of factors, including heart disease like coronary artery disease or heart failure, electrolyte imbalances such as low potassium or magnesium, stress, caffeine, alcohol, tobacco use, and even certain medications like decongestants or asthma inhalers. In some cases, no specific cause can be identified, which we refer as idiopathic PVCs. Now, let's talk pathophysiology, how PVCs actually affect the heart. Normally, the heart's electrical signal starts in the sinoatrial SA node, the heart's natural pacemaker, and travels in a coordinated way through the atria and ventricles, leading to a regular heartbeat. However, a PVC interrupts this coordinated process. When a premature signal originates in the ventricle, it causes that ventricle to contract before it's supposed to. This early contraction is usually followed by a pause as the heart's electrical system resets. The next normal beat is then often felt as a stronger than usual beat because the ventricles have had more time to fill with blood. This disrupted rhythm can reduce the heart's efficiency in pumping blood, especially if PVCs occur frequently. PVCs are quite common. It's estimated that most people experience at least one PVC in their lifetime. They become more prevalent with age and are often found in people with underlying heart conditions. However, they can also occur in otherwise healthy individuals. Studies have shown variations in prevalence based on age, gender, and the presence of other risk factors. Many people with PVCs don't experience any symptoms at all. However, some individuals may feel a variety of sensations. These can include palpitations, which feel like skip beats, fluttering, or a pounding in the chest. Some may describe a feeling of lightheadedness, dizziness, or even shortness of breath, particularly if the PVCs are frequent or occur in rapid succession. Rarely, if PVCs are very frequent and prolonged, they can contribute to fatigue or chest discomfort. Diagnosing PVCs typically involves an electrocardiogram or ECG, which records the heart's electrical activity. An ECG can capture the abnormal electrical signals characteristic of PVCs. Sometimes a standard ECG may not catch the PVCs if they are infrequent. In those cases, a Holter monitor, a portable ECG device worn for 24 to 48 hours or even longer, can be used to monitor the heart rhythm over a longer period. An event monitor, which the patient activates when they feel symptoms, may also be used. Additional tests like an echocardiogram, ultrasound of the heart, or blood tests to check electrolyte levels may be performed to evaluate the overall health of the heart and rule out other potential causes. While not strictly classified into distinct types, PVCs are often described based on their frequency, morphology, appearance on the ECG, and pattern. For example, they can be described as frequent if they occur a certain number of times per hour or day. Monomorphic PVCs look the same on the ECG, suggesting they originate from the same location in the ventricle, while polymorphic PVCs have different shapes, indicating they arise from multiple locations. Bigeminy refers to a pattern where every other beat is a PC, and trigeminy means every third beat is a PC. Treatment for PVCs depends on the severity of symptoms and the presence of underlying heart conditions. For many people with infrequent PVCs and no other heart problems, no treatment is necessary. Lifestyle modifications, such as reducing caffeine and alcohol intake, managing stress, and quitting smoking can often help. If symptoms are bothersome or PVCs are frequent, medications like beta blockers or calcium channel blockers may be prescribed to help control the heart rhythm. In more severe cases, particularly when PVCs are causing significant symptoms or leading to heart dysfunction, a procedure called radiofrequency ablation may be considered. This involves using catheters to deliver energy to the area of the heart causing the PVCs, effectively eliminating the abnormal electrical signals. Electrolyte imbalances will be corrected. Preventing PVCs often involves addressing the underlying risk factors. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive caffeine, alcohol, and tobacco, can help. Managing stress through relaxation techniques like yoga or meditation can also be beneficial. If you have an underlying heart condition, working closely with your doctor to manage it effectively is crucial. Regular checkups and adherence to prescribed medications can help prevent PVCs and other heart rhythm problems. The prognosis for individuals with PVCs is generally good, especially if they have no underlying heart disease. In these cases, PVCs are usually considered benign and don't pose a significant risk. However, in people with underlying heart conditions, Frequent PVCs can sometimes worsen heart function or increase the risk of more serious arrhythmias. Recent research has focused on refining techniques for radiofrequency ablation to improve success rates and minimize complications. Studies are also exploring the potential role of genetic factors in the development of PVCs and identifying new targets for drug therapy. Furthermore, advancements in wearable technology are enabling more continuous and accurate monitoring of heart rhythms, allowing for earlier detection and more personalized management of PVCs.